Hello and welcome everyone, and good evening to all of you. I am very pleased to welcome you all to our webinar. My name is Amanda, and I'm a fourth year dental student from Queen's University, Belfast in Northern Ireland. And I am the Volunteer Work Officer in EDSA Committee. And I'll be moderating today's session on the ethics of volunteering. So to start off, I'm extremely delighted to have this meeting with everyone, and am proud to advocate for such an important message for healthcare or in general aspects. The objectives of today's aims include identifying ethical aspects of volunteering in dentistry in both prevention and clinical settings, and to raise awareness on this topic among students by introducing them to the professionals in these areas, as well as sharing good practices from our guest speakers. Just to be clear, this session is interactive, so please feel free to share any thoughts or questions and type them in the chat box. At the end of the session, we'll have a separate time for your questions as well. So to ask a question, you can use the Q&A feature of the Zoom meeting. The following presentations will go in the following order. Firstly, we'll have Dr. Andrew Patterson, who is a senior clinical lecturer and honorary consultant in restorative dentistry at Dundee Dental School in Scotland. He's a trustee and a member with the UK Dental Development non-government organization called Bridge to Aid. Dr. Patterson has lived and volunteered in 4 sub-Saharan African countries, and his research interests are on the ethics of international healthcare volunteering in the developing world. During COVID-19, he led the delivery of a collaborative training program between non-government organizations, government, and communities to teach dental therapists in northern Malawi to cascade for key oral health messages to remote and rural areas. As such, he'll be presenting to us about the pitfalls and benefits of volunteering in these disadvantaged communities. Secondly, we have Ramesh Chanda, who is a dental therapist currently working in NHS and dental practices in Dumfries and Carlisle areas in the UK. Before moving to UK, he worked in Blantyre, Malawi as a dental therapist. While living there, he had a chance to work with various international oral health voluntary charities, and he'll be providing us firsthand what his experience was like and how volunteering has had its impacts. Lastly, we'll have Katie Challen, a final year dental student in Glasgow Dental School. She was lucky enough to join Scottish dental charity Smalawi in Malawi in June 2019, where a team of students and charity members carried out research and measured the burden of dental decay of children in rural areas. In September 2019, she also studied an intercalated Bachelor of Science degree in Global Health at University of Glasgow. So without further ado, I'll hand this over to Dr. Patterson, who will now start off with his presentation.
Thank you, Amanda. I'll just share my screen. I've got screen sharing disabled at the moment, Amanda.
Hold on, just give me a second. Okay.
Okay, I think it's working now.
Okay.
Can I just check that before I start that people can see the screen?
I can see it, yeah.
Okay, thank you.
Sure.
So, first of all, thank you for inviting me to speak at the webinar today. And I'm going to talk about the pitfalls and the benefits of volunteering. By the end of this talk, you should have an awareness of whether you currently should be considering going on a volunteering program. You should be able to identify common pitfalls and benefits in volunteering programs and describe how to benchmark a volunteering program. By way of background, let's consider why health professionals volunteer. By far the commonest reason people volunteer is simply to help others, and people seem unable to explain why. Some people volunteer as they feel it's their social responsibility or for them being a global citizen. The hero's adventure model is an interesting reason for volunteering, where people really seek adventure and then utilize on their return things like social media to promote their adventure, passing themselves as a bit of a hero. For many, volunteering is about a simple reflection of the principles of healing and service that characterize healthcare professions. Particularly among older volunteers, exchange theory is a reason for volunteering, where you exchange perhaps work when you retire for volunteering. Religious motivation remains a big driver for volunteering, and this, of course, is how volunteering predominantly started many years ago. Some people volunteer simply to enhance their CVs, and some as a method to go to inaccessible parts of the world on holiday. And this is the so-called voluntourism, which is largely tourism, with volunteering being a tiny component of it. For many, volunteering involves many reasons from this list, and this list is by no means exclusive. Importantly, the reasons for volunteering are poorly understood by volunteering organizations. So, should you volunteer? Well, the English National Health Service produces this great framework for NHS involvement in international development. They ask people to reflect on whether they currently have the necessary skills and attributes. And this is something that you should do. So, for example, if you're planning on going on a volunteer trip that involves extracting teeth, ask yourself if you currently have the skills to do that. If you don't, perhaps acquiring the skills and doing it at a different time may be more appropriate. Volunteering usually involves teamwork. So you need to reflect on what your role will be in the team. And are you happy with that role? Or are you indeed a team player? Because if you're not, you're going to struggle as a volunteer. You need to try and work out, and you have to be really honest about this, if you have the physical, mental, and emotional health to withstand developing world environments, many of which are very challenging. Going hand in hand with that is, do you have the resilience and the problem-solving skills to face the multiple problems and difficult situations that will present? Volunteering will be challenging to others in whatever volunteering team you're in, and in many cases, you need to provide support to others, and they will provide support to you. So ask yourself, am I sensitive to the needs of others? Volunteering is not for everybody, but it can be very satisfying and rewarding. In deciding whether you should volunteer, remember there are risks. In most cases, your normal support network will be unavailable, as there will be inadequate communication such as Wi-Fi, so phoning home to discuss a problem may not be an option in some instances. Look at this slide and you'll see a patient and he's dying. He is presented to the clinic with a very large swelling. You can see the facial swelling and the physical wasting together with his neck nodes and his advanced cancer, which is so advanced he could barely swallow and he cannot occlude his teeth. This is a situation you will rarely encounter in the developed world. And knowing that you can do virtually nothing for this patient other than send him home to his village to die, puts a volunteer in a situation which can create emotional and mental health risks for the volunteer. It's not uncommon to have volunteers breaking down on site and needing mutual support, and some find difficulty coping on return. Flying out from a situation like this to the following week being in a developed world clinic can often involve lack of empathy in developed world situations. It's quite difficult to go from a patient like this to dealing with somebody's chipped composite the following week. Remember, some volunteers will end up with some form of post-traumatic stress disorder. And the sign of a good volunteering organization is that they look after their volunteers on return, not just during the trip. Reflect yourself on your own abilities to currently cope with situations like this patient. So what's in it for you? Volunteering will have benefits for you. You will be better able to work in challenging environments, and you will enhance your leadership and professional skills. Furthermore, volunteering will give you a greater understanding of ethnic and social diversity and better cultural confidence. Unfortunately, the history of volunteering is one of paternalism and neo-colonialism, together with conflict, structural political change, emergent diseases such as HIV, health inequality, and cross-cultural tensions involving many different groups and individuals. So today, volunteering is a complex patchwork of organizations and individuals, which is largely uncoordinated and has been criticized as being small-scale, piecemeal, and underfunded. In many instances, there is a failure of volunteering organizations to understand and dovetail with the health priorities of local communities and governments. And it is often criticized that it is more about the volunteer than the volunteering. Added to that, that oral health volunteering is more problematic, as oral health itself is often a very low priority in the health budgets of many nations. Now let's look at the common pitfalls in volunteering. It's important to say that these are largely unintended, as most volunteer organizations usually seek to do good. Unfortunately, some have no insight into the consequences of their actions, omissions, or programs. Additionally, nearly all will state that they are sustainable when some have no plans for sustainability. A lot of the pitfalls have been found by qualitative research, and I will present some common pitfalls from both secondary and primary research. Underpinning or overwhelming the local health system is a very common pitfall. Aftercare can be dumped on ill-prepared local staff after the volunteer program has left the area. Think of a local health worker having to deal with dry sockets after hundreds of dental extractions. Here's a quote from a Ugandan dentist. A team of over 30 Americans came in on a tooth camp mission, and they stayed 5 days. They found extractions difficult. I spent months taking out broken roots and dealing with infection since they left, and I couldn't do my normal duties for many months. A worrying example is from a Tanzanian regional dental officer who was faced with a large team of volunteers arriving in his area with little warning and no discussion. They came with lots of modern equipment, did dentures and root treatments and fillings, and said they would come back the following year. Then they took the equipment away. The dental therapist had been in the community for 8 years, but no one would see him as they were waiting for them to come back to do things he couldn't. They didn't. The therapist left and went to another region, and now I can't recruit another therapist. The district currently has no dental professional and is worse off because of a volunteer team that came unannounced. It's no wonder this Tanzanian regional dental officer is suspicious of volunteering NGOs. Another pitfall of volunteering is the ethical double standard. Some volunteer organisations work out with local governance and regulations, and some provide lower standards of care, feeling that anything is better than nothing. Here's 2 examples. X is a UK dental nurse who proudly informs that she carries out procedures on her volunteer mission that she wouldn't do in her normal job, such as fillings, simple extractions, and anaesthetics. She's actually operating illegally and untrained. Here's one from a senior Malawian dentist. A Dutch NGO came uninvited to do an endodontic CPD course for dental therapists. We asked them to stop, as it's illegal for therapists to do this, as they're not trained. They were angry, saying, "You should just accept our help." They wouldn't stop, so we got them deported the next day. Now, had this Dutch NGO discussed the matter with the Dental Association of Malawi, the Ministry of Health, and the Medical Council of Malawi, they may well have got approval to run the endodontic CPD course for dentists rather than dental therapists, which would have been well received. But by not taking the time and effort to find out about the local health systems and regulations, the whole volunteer trip was a waste of time for all concerned. Volunteering NGOs need to have a clear idea about their programs. A common pitfall is that the programs are more about the volunteers' needs, interventions being for the volunteers' own experience rather than clinical need. Techniques to just try out something can be used using techniques that you would not safely practice in a developed world situation. Many are criticised for being a practicing ground for students, carrying out procedures that may be beyond the student's competence, with supervision being inadequate. Barbara and Bowie wrote a great article which highlighted some of the problems NGOs can inadvertently create, which I've loosely titled as being left in the lurch. Sometimes changes in NGO management in donor countries can mean that an NGO program in a developing world country can simply be dropped with little or no warning, with no plans for an ethical exit strategy. As many NGOs are small scale, piecemeal and underfunded, NGOs fail, again leaving the host country with the sudden loss of a service Many, for example, will not return post-pandemic. A change in government policy can have massive impacts in the developing world. For example, in 2004, a change in the Danish government meant 3 months after an election, they withdrew funding projects to Malawi, which was so sudden that projects were simply abandoned with no thought of the impact for those communities. In larger NGOs with a big staff, visiting NGO executives often require to be entertained, which takes staff away from more purposeful activities. And finally, the spending power of some NGOs is massive in a developing world situation. So they have the ability to poach staff, key staff at all levels, offering large salaries, which may have impacts on the functioning of basic services, causing more harm than good. So that's all pretty negative, and you have to ask yourself, why bother? Why don't we just not volunteer at all? The reason is that there are quite a lot of benefits. So rather than listing the benefits, I'm going to look at a case study, which will give you a flavour of the beneficial impacts volunteering can do for oral health. We will look at volunteering to attempt to address oral health needs in rural sub-Saharan Africa. By way of background, it's important to realise that 80% of the population in this area is rural. Within health budgets, there is prioritisation of HIV/AIDS, TB and malaria, with minimal budgets for oral health. In consequence, aid and grants tends to be targeted at priority areas, so oral health is not prioritised. Alongside this, there is poor transport, sanitation and power infrastructure, and a massive lack of healthcare workers in rural sub-Saharan Africa. Specifically, let's look at Rorya district in Mara region, Tanzania. Many of you will be familiar with Mara because it encompasses the Serengeti National Park. And to give you an idea of the size of the park, it's the size of Montenegro, and Mara is bigger than Slovenia. Mara has one dentist for 2.2 million people, and Rorya has no dental staff or facilities for 300,000 people. It's the district with the highest HIV/AIDS rate in Tanzania at 12.5%, and has had many previous failed health initiatives. So when there's only one dentist for 2.2 million people and you have a dental problem, what can you do? Well, you can either put up with your situation or undertake some self-care by killing poults with used car battery acid. You could visit a traditional healer or untrained extractor using unsterilized instruments, or you could acquire some antibiotics and hope. But only a minute percentage of people will access appropriate care. Oral health in Rorya is horrendous. There are no restorative options and no understandings of oral health. Toothbrush and toothpaste are largely unaffordable, and life-threatening sequelae of dental abscesses are not uncommon. Here you will see some photos of oral health in Rorya, from extensive calculus to an advanced cancer, to a mouthful of retained roots, and just general poor oral health, hygiene and caries in a teenager. So if an NGO wants to do something in a place like Rorya, what do they do? The first thing is to speak to key stakeholders, and I've put on this slide some examples of key stakeholders, from government to toothpaste companies to the Dental Association to a local NGO, as well as key people, national and local. Ask these key stakeholders, what do they want? And then look at yourself as an NGO to decide if it's actually realistic in that you can help. Negotiation then needs to take place, because undoubtedly there will be a gap between what is wanted and what is realistic, and therefore things will need modified. NGOs cannot work alone. It must work in partnerships, so it needs to be established what partnerships will work and who will be responsible for what. And finally, the NGO needs an exit strategy, so it needs to build sustainability. So the NGO concerned in this case is a UK NGO called Bridge to Aid, who focus on task-shifting medical officers so that they can treat basic pain via extractions, promote oral health within their communities, and cascade that information to other local community workers such as nurses, and recognise and refer serious problems such as you see in this slide, where this man has an extra oral sinus from a carious lower third molar, which is turning into necrotizing fasciitis. Following negotiation, a model is developed. In this case, this is a one-to-one 9-day training program using a team of volunteer dentists, therapists, hygienists, and nurses. Local implementation NGO and Tanzanian government dental professionals to train independent practitioners who understand their limitations and are taught to provide simple emergency dentistry and give oral health promotion to their communities, and to sterilize and disinfect instruments to WHO standards with no need of electricity or running water, using locally sourced sustainable equipment and modern learning, teaching and assessment methods. There's a 92% pass rate, and these medical officers can deal with 98% of dental emergencies, with the program being driven by the needs and wishes of the Tanzanian government and local communities. But the devil is really in the detail if these programs are going to be successful. Following discussion with governments and communities, the Western model of dentistry is discarded in favor of the WHO package of basic oral care, and using simple WHO-approved sterilization methods and equipment and materials available locally. Sustainability is inbuilt. Here you can see myself training a Tanzanian medical officer to give a local anesthetic. If you look closely, he's giving it with local anesthetic drawn up from a bottle using a wide-bore syringe, because that's what's available in a rural health centre. This is not something that we would do in a developed world situation. And undoubtedly the injection is more painful than a dental syringe needle, but this is what's available and therefore is appropriate to the situation. The success in volunteer programs involves sustainability. And that is only possible when there is community engagement, compromise from all, collaboration, cooperation, and partnership with all stakeholders. The NGO's role is often one of coordination. I will focus on just one of these, which is community. Often the local community is ignored, which is a mistake for NGOs. It's so important to speak to people at the community level, so the community understand and are on board with the ethos of the NGO, the volunteers and the program. Here we see the type of community engagement that you must do. On the bottom left, I'm talking to a village elder and the village chief about the program. In the center, we have given a forum to a village elder to visit the program and to have it explained so he can discuss it with other village elders and the rest of his community. And finally, formal visits. The local government officials within communities are imperative to seek permission and approval for being there and to be culturally welcomed as a guest in their community. Doing these things makes for a culturally competent NGO, and one where the benefits likely will outweigh the pitfalls. So can volunteering be beneficial? Well, the answer is yes, but it is only an adjunct to health policy. You have to be realistic. You're not going to change the entire health policy or priorities of a country. So you must have realism on the impact of a program, and it is likely the impact will be less than you hope for. To remain beneficial, an NGO needs to be responsive to change, as developing world health services are changing all the time, as are the health priorities within them. In many cases, the volunteer organisation, by doing the program, has a greater role in influencing and raising awareness of health inequality to others in donor countries. For volunteering to be beneficial, it must be underpinned by being based on host community needs, and finally, sustainability needs to be at the heart of volunteering. On this slide, you see that one dentist for those 2.2 million people, Dr. Neela Jackson. Sustainability is Dr. Neela Jackson, because he has been trained to train his own medical officers. And after the volunteer team have long gone, he will continue to do so, increasing the number of task-shifted health workers and improving oral health of Rorya district. Finally, if you're considering volunteering yourself, how do you choose a volunteer program? How can you benchmark it onto your program? The important thing is to ask difficult questions, because the public image of the organization on social media and on the internet will always be positive. Try and find out if they have a plan, and if that plan seems sensible to you. Ask questions about safety, about volunteer safety and patient safety, and see what answers you get, and are you satisfied with those answers? Find out about the NGO's governance. A red flag warning sign will be if there is no basic governance within the organization, such as oversight policies and health and safety policies. Ask the NGO what partnerships they have, as realistically, it's impossible to carry out an ethical volunteering program on your own. You must have collaborative partnerships with many other organizations. If you do not do this, this is a potential red flag. Ask about sustainability. Weigh it up in your own mind and decide if the NGO is truly sustainable. If you volunteer with the organization, are they going to give you pre-trip training? Because this is so important, so that you're not put in a difficult situation without any training. Ask to speak to returning volunteers from previous programs, and be wary of organizations who won't let you. Finally, this article, geared for medicine but totally applicable to dentistry, gives some really good tips for undertaking reflexive global health experience and will help you benchmark programs. I'll put that reference in the chat. So thank you for your attention.
Thank you, Dr. Patterson. I think I'll hand this over now to Remus Chanda. That was very informative. Remus, would you like to continue?
Yeah, sure. Can you see my screen there? Yeah.
Yeah.
Yeah, so my name is Remus Chunda. I'm from Malawi, and I'm a dental therapist, as you have already heard. Actually, the main aim of my talk is just to give an overview on my personal reflection and experiences of working with faith-based voluntary health charities in Malawi. And the objectives are to describe personal experiences of working with particularly an American voluntary oral health charity, and explore better ways of engaging with the local oral health workforce, examine the influence of health on voluntary charitable works, and explore the role of local partnerships and planning. Review of evidence. Volunteering is an act where an individual or groups of people freely offer services or their time to the community. Wilson, 2000. However, medical volunteering has attracted negative criticisms. Evidence continues to suggest that some voluntary organizations are not doing their work properly. And some of the references are there. My personal experience dates back to 2006. This is when I was working at Queen Elizabeth Central Hospital in Blantyre, Malawi. And Blantyre is in the southern part of Malawi. So if you see on there, that's the map of Malawi, and Blantyre is on the southern tip. It's one of the biggest cities in Malawi there. So it's on the southern Malawi there. I was approached to meet oral health professionals from the United States of America, and we're supposed to meet at a local hotel in Blantyre Central Business District. And there were approximately 20 oral health professionals who were present at the meeting, and I was the only local oral health professional. Before the meeting, I was told to kneel down so everyone can pray for me, and they didn't ask me about my faith or belief. I was promised pay after assisting them in their charitable works, and unfortunately, I didn't get that pay in the end. And I was also told to source for some dental extraction instruments and an autoclave for them. And they told me that they would provide PPE, and I took days off from my work for the whole week. the first day at a faith-based orphanage. So we traveled to Cholo, which is in the southern Malawi as well. It's one of the smaller districts in the tea growing districts of the Shire Highlands. So when we went there to their orphanage, there were huge crowds of people who were waiting to receive oral health care. And patients did not have options but join in the singing, because it was more of like they had started singing church songs. And there was no oral health assessments, no examination, no diagnosis. We just were told to start extracting the teeth. We did not have any referral system for the patients or for those with difficult extractions or complications or bleeding problems, or those with abscesses. And the number of patients with fractured fillings was overwhelming. I was wondering, because I've never seen, working as a dental therapist in Malawi, I've never seen like fractured fillings like what I saw during that week. And most of these fractured roots actually were just left in people's teeth. We couldn't remove them, because actually there was no enough capacity to do that, and considering the number of patients who were present. So these people were just told to go and fend it for themselves. And we also did not consider patients with blood clotting problems or those with underlying issues. And the following day, after noticing these problems, I thought it wise that I should start telling these patients to come to Limbi Health Center, which was part of the areas where I was covering, because that time I was covering mostly some of the health centers in Blantyre urban. So Limbi was one of my catchment areas. So I started telling the patients that maybe they could try to come to Limbi Health Center so that I could probably help them if they have any complications. However, I realized that that was a huge problem with these people, who are mostly poor people, who are village people, and they couldn't afford transport, which, because Cholo district is almost like 30 miles away from Blantyre. And I noted that this charity could have performed better if it partnered with the Ministry of Health, because the fact that they just got my phone number from maybe one of their friends and phoned me, I thought it would have been wise if they had gone through the Ministry of Health in Malawi. And it would also have been wise if they had registered with oral health professionals, or their oral health professionals with the Medical Council of Malawi, which registered all the clinicians and health professionals in Malawi. It could also have been wise if these people had partnered with the national and regional oral health coordinators. It could also have been wise if these professionals or oral health professionals from America could have partnered with the local oral health workforce or workers in Blantyre. And it could also have been better if they had established a proper referral system with local government district hospitals or Christian Health Association of Malawi community hospitals, which are mostly available in most of the districts in Malawi. This charity could have done better if it had adequate instruments, for example, like autoclave for sterilization of their instruments. And they could also have had positive effects in terms of positive patient responses and outcomes, and their charity's sustainability and the public confidence. Separation of faith from voluntary work. The notion of altruism as an extension of Christian missionary ideology has been criticized in the past. In the 1960s, there was this philosopher, Ivan Illich, he was a philosopher as well as a theologian. He criticized the American volunteers who were working in Mexico because their intention was not medical volunteering, but evangelism. And there are also these writers or authors who have criticized voluntary charities of bad intention. That is not the only charity I've encountered in Malawi. I've also encountered some good charities just of recently. I worked with a Scottish and UK-based charity where we offered digital training to all health workers in Malawi. And this was on various topics, which will be used for their CPD. This is the charity which Dr. Patterson works with. And I'm happy to say that this charity is doing great there, just because it will address the issue of geographic inequality in Malawi. Because most of the American charities which I've encountered in the past in Malawi, they mostly like working in one particular area. For example, maybe in that area or district, maybe it's where their missionaries are, or maybe where their evangelism agenda is, they will be just working in that area. But when I worked with this charity, which Dr. Patterson introduced me to, I found that I think their aim is good for Malawi, because they aim to cover the whole Malawi, or all regions of Malawi. And working with this charity has also taught me the importance of planning and partnerships. And also, despite the COVID-19 pandemic, we managed to provide all the CPD, all the courses to the Malawian oral health professionals virtually. So thank you very much for listening to me. And that's the end of my talk.
Thank you, Ramis. That was a quite interesting experience that you have shared with us. And I'm sure it has been the same. Most people, everybody will feel the same way. And now I'll just hand it over for Katie to share her student experience.
Thank you. I've also just seen that there's a Q&A in the box. I don't know whether we want to answer that now or wait till the end. Somebody's just asking, is it always bad to bring modern equipment to the rural areas when coming as a student? I don't know whether Andrew or Remus wants to answer that, or whether you prefer to take that question after my presentation. I don't mind.
I'm happy to say something on that just now, and maybe Remus has something as well on that. But I think it's not always bad. I think what you have to do is ask what to bring. Is the important thing, is to engage with where you're going, with the health professionals that you're going, and say, what do you need? And rather than bring what you have, to bring, if you're going to bring anything, to bring what they want. There have been some pitfalls in people donating equipment, to the extent that the WHO actually have guidelines on how to, on appropriate ways of donating equipment in developing world countries. If you search the WHO website, you will find it's relatively out of date now, and I think they're going to modernize it. But it talks about what you should and what you should not send. So do I donate equipment? Yes, I do sometimes. I do, particularly to the dentist who you saw on the screen, but I do that in consultation with him and say, what do you want? Fairly recently, for example, he ran out of Calhoun forceps and Cryers elevators, and we managed to get some across to him in the pandemic. So that's the type of, but it was a very specific need for something that he asked for. Thank you.
Sorry, so no single-use products, but elevators and stuff that you can use again. That's the point.
Yes, I think one of the things which is controversial, of course, is donating out-of-date equipment. You know, we donate. You know, you have some endodontic files that go out of date, or endodontic files that have come from China and aren't CE marked. And I would say, if it's not good enough for use here, it's not good enough for use there. So it's about donating. You actually want quite high quality equipment to go out there. So you want really good, if you're sending elevators and forceps, you want really good quality elevators and forceps, because they're going to get an awful lot of use, far more use than they would in the developed world.
Yeah, thank you. There's another question. Isn't it hard to offer an online training for the rural health workers?
Yeah. I think that the short answer was yes. It was hard, but not impossible. And that again was a true collaboration. This was a collaboration. It was between a UK CPD provider to trialing out things on obsolete devices, to working out what works best, which was actually Zoom recordings in low resolution video, and then partnering with a whole host of people. So this involved the NGO that I'm involved in, involves Malawi, which Katie is involved with. It involved what Professor Bag was involved with, the Malden project, and it engaged just so many organizations and people that no one has the one skill set to do that. So that happened and worked because lots of people collaborated and lots of people problem solved, and everyone's little input made it work. So yeah, yes, it was difficult.
You need to have a very good contacts and like frequent communication with the person on the other side or in the country, right?
Yeah, I mean this crossed several countries, and including dentists, dental therapists, and all sorts of people. I mean, we trialed the how this worked to a dental therapist on an island in the middle of Lake Malawi, because we decided if that worked there, it would work anywhere, and luckily it did.
Yeah, thank you so much. Okay. Should we now proceed with Katie's presentation, please?
Okay. I'll just share my screen. Can everybody see that okay?
Yes.
So I'll be talking about my journey as a student into thinking more sustainably about volunteer work, as well as the journey of a healthcare charity that I worked closely with, which is Malawi. This presentation kind of leans more towards the good, bad and ugly, but obviously, as we've seen from Andrew and Remus's insightful presentations, there's a lot of pitfalls to look out for. So I'm still going to be offering quite a critical view of healthcare volunteering. Quick background about me. I'm a final year dental student at Glasgow. I took part in a public health-based elective in June 2019, where I had 3 weeks of overseas volunteer experience in Malawi with Malawi. Following that, I took a year to study global health, and I based my project around how Malawi operate because of my developing interest in charity work overseas and how it could be globally more effective. I'll briefly touch on both projects today, and I hope to open up a little bit of a discussion. I don't know the people listening today, I'm not sure of other people's experiences, so I just want to open up a discussion around if other people have volunteered abroad and how they found it as well. I'd like to start with the question of whether it's ethical for students to carry out treatment abroad. I know that some people here might have experience of carrying out treatment abroad, so I don't mean to come across judgmental at all, but it's a topic I find quite interesting because Glasgow banned students from treating patients abroad on elective around 6 years ago due to safety and ethical concerns. The elective was something that I've looked forward to since even before I came to dental school. I'd been interested in going travelling and wanted to do it with a skill that I could offer kind of anywhere in the world, which is dentistry. And when in first year, me and my peers found out that we couldn't do treatment abroad and Dundee University could, we were very gutted, and we were like, why can they do it and not us? Why can't we? We want more extraction experience abroad, and we want to offer help to places that might need it. But over the years, my opinions kind of changed of that, and I came to realise the dangers with it, as well as the benefits of doing public health-based and observational electives as well. So much of the same problems exist for students treating patients as they would for qualified professionals. And a lot of it does just root from the charity that you're going with as well. These have been touched on in Andrew and Remus's presentations, so I won't go over this too much, but I think personally, I thought that the issues for students would centre around a lack of experience and confidence levels. So my roommate, when I was on elective, she's from Dundee University. She got speaking to Andrew Patterson at Dundee because she'd read reports of other student electives where they'd done treatment abroad, and she said it just sounded unsafe and quite stressful. So doing fillings with birds falling out of the handpieces, and just feeling really unsafe and not having the kind of confidence to say this needs to stop if there was so much need in a country. So I'll just briefly touch on voluntourism because it's definitely been covered in the other presentations. Also, a lot of the literature that I got this from is stuff that Andrew kindly lent me for my intercalated degree and projects. So the kind of concept of voluntourism is where the volunteers benefit more than the people in the host country, and it's something to try and avoid. It kind of touches on colonial ideas of care where locals are often seen as recipients of aid only, as Andrew said, and service provision alone is seen as good enough, which can lead to dropped ethical standards in volunteer work abroad. Professor Bagg put it to me, like, imagine a group of dentists from Malawi coming over and not registering in, say, Scotland, where we are, and turning up to a rural village without telling the governments, without telling the dental associations, and just starting treatment. That's the kind of idea if you flip it and think about what's happening with some of these charities abroad, and it wouldn't be ethical in your own country, so why is it ethical there? So what other ways can healthcare students contribute to overseas aid? This is where I'm going to promote kind of more public health-based and observational electives from my experiences. So my elective was a public health-based one, travelled with the dental charity Malawi. They usually carry out treatment in rural areas of Malawi, and they're moving more towards sustainable models of care, including collaborations with Bridge to Aid. Before the trip, I was concerned about voluntourism. I'd read some of the papers that Andrew had recommended me, and I was kind of conscious of not wanting to benefit more than the people that we were there for. I was very kind of conscious of that. But before we went to Malawi, we had a lot of planning meetings with Malawi, the charity, and public health professors at Glasgow, where we were trying to adapt a national oral health survey for a Malawian context. And in doing so, with the experience that Nigel and Vicky from Malawi had of going to Malawi for 10 years and threshing out the details of this project, helped me along the way learn a lot about the culture before I went. And we had a lot of questions answered to us by Vicky and Nigel, which I thought was a really good quality that you should look for in a charity as the kind of pre-preparation before a trip. Once we were there, we did checkups using disposable mirrors and head torches and fold-away chairs. We saw over 2,000 children in the 3 weeks we were there, which contributed to a wider study carried out by the public health professors at Glasgow. And in turn, it's contributed to a body of evidence needed to implement a national oral health survey across the whole of Malawi, including a prevention plan. And this is in conjunction with Professor Bagg's charity, the Maldent Project, who helped build the first dental school in Malawi. And these kind of collaborations have turned into hopefully getting a dental preventative plan done there. And there was a few other things we did on the trip. That picture in the bottom right of the teeth with fluorosis was quite an interesting aspect of the project where we were helping with a geography study at another university, measuring the levels of fluoride in the water. And there was actually a small correlation between, in the south, in close to Blantyre in Malawi, there was loads of fluorosis seen in children, and the most severe cases that Vicky and Nigel, the experienced dentists we went with, hadn't seen before in their careers. And we noticed a rise in the kind of fluoride levels in the water. And we also did conferences with dental therapists and went around to schools for children with deaf and blind disabilities, handed out reusable period products, and kind of all these kind of little experiences made me realise the kind of overall picture of this community that Smilawi had created, and the projects that they were willing to get involved with. It seemed like they were very a yes charity that always wanted to collaborate with other people. So this is what kind of inspired me when I was on the trip. Again, a lot of the literature focuses on people's reasons and intentions for going abroad. So again, it's to avoid that concept of voluntourism, which is kind of common theme here, because it can lead to more harm for people in the host country and purely just benefiting people going over. So again, like I said, I was very self-conscious whilst we were there of not wanting to be a voluntarist. I also think when you're thinking about why you want to go, like for me, travel was a reason for wanting to go abroad, and it shouldn't be the only reason, but I think it's part of that global citizenship of wanting to kind of learn about a health system in another country and help where you can, where there's need. So there is social responsibility, but I also think as long as you're thinking critically about who you're going with, and why you're going, and not just for travel and not just for going on a safari, then that's important. So a few of the good things that Smilawi did was staying within the local communities, and a lot of the kind of tourism stuff that we did there was visiting people that they'd met in the community, and getting involved with social projects there. So the Mizuzu Coffee Den was somebody that they knew who ran that business, and the little shop on the bottom left there was run by a guy building woodwork kind of items, and he was collecting and giving his profits back to the local community, and they wanted to support that as much as possible. Also with the safari at the bottom, I think there's been a lot of instances, me and Andrew and Remus, when we were planning this talk, we were talking about some charities coming in for 3 weeks, and a week and a half of that is doing the safari, while Smilawi, it was right at the end of planning the trip, said, shall we add a weekend on and go to a safari? So the focus was really on kind of project, on the work we were doing, and we worked hard for those 3 weeks doing the surveying and typing it up every evening, and just adding on the kind of tourism as an extra in your kind of spare time. But the point I wanted to make was, you know, travel is definitely a reason for people going, but as long as you think critically about who you're going with and if you're doing good. So how do you pick an ethical charity to volunteer with? For me, I'd say it was pretty lucky that the Smilawi contacted the dental school and offered this public health based elective. We didn't offer treatments, and kind of my treatments abroad and my experience of the public health trip taught me a lot more about ethical student volunteering and got me really thinking about that. So I was definitely lucky in that respect. I just want to touch on a book I read which got me interested in this topic at the start as well, which is called Doing Good Better by William Macaskill. I think it's quite an obnoxious title actually, but it did have some really interesting points and quite radical ideas for how donations and volunteering could be globally more effective. So I really recommend it. It's a great read. They use kind of evidence-based approaches to determine how charities can do the most good with their time and their money, and also how people can use their own skill sets to contribute the most effectively to kind of the global picture of charities in need. So my research project was exploring the operations of Malawi from multiple perspectives. So it was evident to me on the trip that Malawi were moving to becoming more sustainable. So I wanted to explore how they operated and the challenges they faced in doing so. And this kind of comes under my bracket of thinking about how you might pick a good charity. So I interviewed 8 participants, including Andrew and Remus, who very kindly got involved with the project. And a lot of interesting points were brought up. I think the interviews being transcribed must have taken a long time because it was some very great discussions. 3 main themes that came up from the interviews were sustainability, collaborative partnerships, and education. So the sustainability challenges included the funding, corruption, and kind of prioritising tasks within a country. And in the evidence I read, background evidence I read around this topic, a lot of charities see sustainability as longevity of their programme rather than longevity of the health system. So they think sustainability means that they can stay in the country rather than when actually the ultimate goal should be that they can leave and a country can operate without the need for charities going in. And then collaborative partnerships. So Malawi worked with so many different charities. I found it really inspiring how they were willing to connect with Bridge to Aid and Dentaid, Clyde Munro, their funders, and under the whole bracket of the Scotland-Malawi partnership, they were always kind of ready to say yes to collaborations. As well as that, collaborations with people within the community. So their interpreters would help them identify where the dental need was. And they had so many connections within local communities that they built really good rapport. You know, they weren't just coming in doing their thing. They were really trying to connect and integrate themselves into communities, and also with local governments as well. So they worked closely with the Malawian Ministry of Health to make sure that their projects were being effective. And involved with that, they offered the Malawi conference every year, which was a great experience to go to because they offered CPD in person and worked with the Malawi Ministry of Health and drew together dental therapists and dentists across Malawi. So it was really great to see the kind of effects of CPD. I think so continued professional development, we call it in the UK, and just continued kind of lifelong learning of dentistry is actually something that I really took for granted coming from a high income country, and how it can be quite impactful for people abroad. So picking an ethical charity to volunteer with, I think Andrew's touched on a lot of these points as well. So again, like I said, I was lucky in picking mine, and my roommate picked hers just to avoid doing treatment abroad, and was recommended by Andrew Patterson for a public health based elective. So like I said, it's not to say if you have done treatment abroad that it's bad, but I would be interested to kind of hear other people's experiences of it today. So I just thought I'd bring a couple of discussion points, although I know that we've run over, so I don't know how much time we have for these, but maybe just things to kind of think about, whether you've been on an overseas dental trip, whether you've done treatment abroad, or if you haven't, would you be comfortable doing treatment abroad from the kind of things that have been touched on today? So my aim for this was kind of to promote more of a public health based elective, and I feel like it was been quite hard to cram a lot of the things in my project and my elective together. But if you have any questions, I'd love to take them. Thank you.
Thank you, Katie. Yeah, we have a couple of questions, but yeah, from my perspective, what I wanted to discuss the questions that you proposed, that I was abroad, but only as like a clinical exchange where I was only observing. So it was just like an exchange of Taiwanese students coming to Slovakia and Slovak people coming to Taiwan. So it wasn't volunteering or anything, just like an abroad experience to see each other's, like clinic and how it's working. So, but I always like dreamed when I was young. I just graduated as a dentist, but I always found it so interesting to go, but I've never seen these obstacles before. Like I didn't go at the end, but I didn't even think of PTSD and the trauma that can be, because everyone's presenting it as pictures on Facebook and Instagram, unfortunately. And it's always so happy that I feel so grateful for helping and stuff like this. But you never see that it can be traumatic if you see that you can't help people. So yeah, it's wow. It was very eye-opening, the whole thing. Thank you. Okay, should I ask the questions that are in the chat? The first one is, was the fluoride from drinking water? I think the question was about the fluorides that you found.
Yes, so the fluoride was from the local water source near a school that we saw in Blantyre. And I think the outcome of the study was that there was only minimal amounts in the kind of spring that we measured, but they found a hidden spring in the water which was releasing a lot of fluoride. So it was in the drinking water from that village. And it was, yeah, like almost every kind of child had really, really bad fluorosis. And when we were speaking to the teachers about it, who also had bad fluorosis, they didn't realise that it was actually, fluoride is good for the teeth, but they've just had too much of it when their teeth have developed. And when we kind of told them that, they were like, oh, everyone in different regions just thinks that we have like bad teeth because they've got all the fluorosis, but actually, the fluoride is actually good for the teeth in the long run. So hopefully the finding of the hidden spring could lead to kind of more fluoride in water in Malawi as well. But it was really interesting.
Could I maybe add a little? Absolutely right, Katie, because that work has proved extremely helpful in relation to the oral health policy. So we've been working for the past 18 months with the Ministry of Health, WHO, and the QHES, the Kamuzu University of Health Sciences, to draft a policy, and fluoride is now going to be part of that policy and how fluoride is managed, because Malawi is at the bottom of the Great Rift Valley, and Andrew knows a lot more about the geography of these areas than I do, but I've learned quite a lot about the geology from the guys at Strathclyde we worked with. And there's huge variation in the amount of fluoride in groundwater in different parts of Malawi. And as Katie said, what this work has helped the geologists to understand is that deep under sediment, there are hot springs that come up with very high levels of fluoride. And by looking at where dental fluorosis is, in a flip of all of this, it's actually helping the geologists potentially to map where they need to be looking for the deep springs. And there are then potentially ways of trying to reduce that excess fluoride in local water supplies. Potentially by dilution, by using more than one borehole and so on. But the other big problem in Malawi is that the permissible level of fluoride in water is currently massively over the WHO recommendation. So part of what we hope will come out of the policy work is that we'll also get a reduction in what is recognized in Malawi as the appropriate level. So just in that little bit of work that Katie and her colleagues did, it really added a lot for the work of the geophysicist people at Strathclyde, and there's continuing work coming out of it. So just to add a little bit of value to what a student elective achieved. Thank you.
Thank you. Is there a way to stop it if it's too much fluoride in the water? It's very hard, isn't it?
Well, the potential is to bore in other areas. It's very difficult to take fluoride out of water. It's a very expensive, complex process. And ideally, of course, what you would want to get to, and Remus might want to comment, and it is piped water, but that's a whole nother infrastructure issue.
Okay, I'm gonna read a couple of more questions that we have. First is, A question by Denise Nasbilgic. She says, first of all, thank you very much for this informative webinar. What would you recommend to dental students who want to touch the lives of people in other geographies? Should their professional amateurishness prevent their good intentions? I just wondered personally, what would you do if you were a student in this situation?
So I think I'll let the others kind of take over this as well, but I think from my perspective, the students offering treatment abroad, I'd totally avoid that. I think students aren't qualified in those skills, and a lot of people do kind of frame it in, oh, I'll get more experience in extractions. Like even qualified dentists frame doing treatment abroad as, oh, it'll get my experience up in extractions and everything like that. And I think when you're not qualified, then it's dangerous for people there, and it can be kind of scary as a student as well. Like some of the reports that my friend read from Dundee Uni, I think some of them just felt unsafe out there. So I think the skills that students can utilize is kind of knowledge, sharing knowledge, prevention, dental health prevention in the country, and just anything that won't take away the local staff needing to, like Andrew was saying, like host and teach the students what they need to do and things like that. So kind of they could be extra bodies, extra hands, and sharing knowledge where they can. And it goes both ways, you know, getting knowledge and sharing knowledge in a country, like working together in partnership rather than just coming and telling everyone about prevention when they might already know it, is the point I'm trying to make. But Professor Bagg, did you?
No, I mean, I think there's also a role for dental schools and deans of dental schools here. So I was the bad person who actually banned these electives 6 years ago, and that Katie was very cross with and her colleagues. But we did it for good reason. But what we said is, what we will do is we will try to establish partnerships with organizations overseas that we are comfortable with, where we know the governance is good, we know the safety will be good. And one of those has been our very close partnership now with the university, what was the College of Medicine, now KUHES in Malawi. And I wouldn't think twice about, in Glasgow, students going to work, not particularly doing treatment, but to have an attachment to my dental colleagues there. I've been there, I've seen it, I know them well, I'm on the phone to them every week. That's fine. So I think it's very difficult for students to know. This is a bit of a minefield, particularly after what you've heard from Andrew and Katie and Remus tonight. But I think there's a duty on academic staff, if part of your program includes elective type studies, to actually help students actually identify them. And as you also heard from Andrew, and people who've listened tonight will have heard the names of at least 3 dental charities who we would say do things properly. I don't know if that's fair, Andrew.
No, I think that's entirely fair. I think the other thing to say is that, remember, as a dental student, when you qualify as a safe beginner. And you're still, in terms of lifelong learning your trade, you have got your whole career ahead of you. And, you know, for example, Bridge to Aid would take somebody after they've been qualified for 2 years. So you can do these experiences as if treatment is what you want to do, if you feel the need to help. You can do that fairly early on in your career, but you will be far more effective with a couple of years under your belt, because things will be new to you when you qualify, but put yourself in a developing world environment and they'll be far harder and you'll have far less support. So you're putting yourself at unnecessary stress. And if you're going to a sustainable charity, in many cases, your role will be about teaching. You'll be teaching or training somebody else, and you have to be confident in your own ability to do that. So just having a couple of years under your belt is really helpful. So I guess the difficulty is you have to be a little bit patient, but you will be more effective if you are.
Thank you very much. We have two more questions. One question is, how important do you think is the effect of knowing the cultural structure of volunteering? As you know, from religious factors to body language, everything can be very different.
I think it's absolutely critical, and it's also critical that you understand that, you know, for example, when I was doing some of my research, one of the things that absolutely surprised me most is the most culturally diverse country in the world is Tanzania. There are 140 different ethnic groups in Tanzania. And we tend to view volunteering as developed world country and developing world country. And we think very much of the developing world country as a monocultural group. So when you understand that the developing world country is not a monocultural country, it has massive ethnically diverse groups that actually understanding things to the detail of understanding in the locality where you're working. As Katie and Remus will well know, that in northern Malawi, where Smilawi operate, the language is entirely different from central Malawi and southern Malawi. So that, you know, there are little things like that, and equally well that there will be little cultural nuances. And that's where pre-trip training is important. And that's where the benchmarking an NGO involves pre-trip training. And if they're doing that, they're probably doing cultural training from where you go. So it's absolutely critical.
I think, you know, having some emotional intelligence when you first go as well, and you pick up almost by osmosis, you know, how those around you are acting and interacting. And I think that's also really, really important. For example, my first ever trip to Malawi back in 2017 was to a curriculum conference. And each day began with a prayer, and each day ended with a prayer. And it was a lovely way to begin and end a day. But, you know, wouldn't do that at the University of Glasgow. But then when I was subsequently organising meetings that my Malawian colleagues were coming to, I would make sure there was a prayer at the beginning and at the end of the day. And I think little things like that can actually go quite a long way to building relationships.
Thank you so much. I think we have the last question here. Can you recommend some projects which you find ethical and sustainable? How can students get involved with Smilawi? That question, isn't it?
So to get involved with Smilawi, I think just they'll have their website online, and I think they will be starting up trips. The thing with Smilawi is usually the trips they do is for qualified professionals. So when they've been doing their treatment trips, it's for qualified professionals, and mine was a student elective, which they approached the dental school to collaborate with. So not that it was a bit of a one-off, they might be doing things like that for students in particular in the future, but most of their trips do involve qualified professionals that go out and help. In terms of other ethical projects, in that book I put in my presentation, the Doing Good Better, they did a rundown of different charities and kind of a comparison with all these kind of parameters that they chose to compare them with in terms of how they evaluate themselves and whether they are actually effective and all these kind of things which judge a good charity from a bad one. And there was one in that did really well in all these kind of rigorous parameters that they had, which was called Development Media International. I haven't done that much research recently after reading that book into the charity, but it's a public health one that does kind of broadcasts public health messages in different countries around the world, and it works with local people to create videos and radio shows and any other kind of media that is commonly used in the country. So they do public health messages through that. I don't know whether it's particularly dental, but it did really, really well in the kind of parameters of this book. And when I looked it up online, it did look really good. I think I'm just very public health based after my elective as well. So I'd say a lot of charities that are public health based would be good. And Development Media International have evidence and research studies that they've done which evaluate themselves, and they get external partners to evaluate them as a charity and make sure that they're being scrutinized all the time. So if you can find a charity online that has evidence that they are evaluating themselves and making sure that they're doing good, then I think that's a good way of picking one. And there was a website that I don't know whether one of the others knows it. There's a website that has a list of charities and they kind of go through and evaluate those charities. If I find it, I'll send it to Edsa if I remember the name of it, but I think it's put in the book, so I'll go through and have a look. But they kind of evaluate charities themselves. So
wow, okay, that's very
and
much.
Again, just picking up on Katie's point, so Nigel and Vicky, as she said, who run Malawi, are definitely changing the emphasis of what they do. Their involvement with Bridge to Aid over the work to provide training materials, CPD materials for therapists is part of that. And we're hoping that through another grant that we have from Scottish Government, there's going to be a significant amount of money for that work to develop and be broadened. And I suspect within that activity, there would be scope for elective student work. I don't know if you'd agree with that, Andrew, but I'm thinking about, assessment of the materials and so on. The other thing that's interesting in relation to the way that Malawi is now looking to operate, as Katie said, that the work that she did was really a pilot for looking at how we would run a national child oral health survey, which we want to do as part of the policy work. And COVID permitting, next year, both Nigel, Vicky, and a dentist from the south of England who worked for 2 years in Malawi as a qualified dentist and has been a community dentist in the UK ever since. The three of them are going to be going out to Malawi and working to calibrate local dental therapists for them to then go and do the National Child Oral Health Survey. So again, there's education in that, and the data are actually being gathered by Malawians. And they see that again as an activity which is different from treatment, but nevertheless extremely valuable and helpful.
Just to add on to that, I mean, one of the just short-term issues at the moment is obviously lots of parts of Sub-Saharan Africa in particular are fairly inaccessible due to the COVID pandemic and the lack of vaccinations in those areas. So other ways of getting involved with NGOs is by contacting them, and many are doing more remote projects. Whilst you don't get to travel, you still get to get involved in some of the experiences. For example, when the course that we all collaborated to deliver to the Malawian dental therapists, we actually used as part of the training Malawian dental therapists from their dental training college to do some of the teaching. So there is opportunities out there, but some of the face-to-face opportunities are not possible at the moment due to some of the restrictions. Hopefully that's improving.
Sorry, I know that it's quite late, but I also wanted to have like one last question, because as an ETSA president, like I say, like from an ETSA perspective, that even 3 years ago, before COVID, we kind of agreed that we don't want to established those volunteer work projects with treating patients as ETSA, because I think we had some history of having that like a long time ago, but not since the time that I am in ETSA, and we decided not to do any of that. So, but I wanted to ask you if you think it's ethical if we could like hypothetically make just like an exchange, just like I was in Taiwan. So the one person would maybe come to Malawi, and then Malawian student would come to Slovakia, for example, establish some kind of like something like to see maybe the culture and the university, or do you think it's also unethical to? I think it's, yeah, please answer. It's just something that popped up in my mind.
Okay. I think it's ethical if it's a two-way street. So one of the problems is it's often individuals from developed countries going to the less well-off country. And it can be very difficult for a student, say in Malawi, to be able to afford to come here. But if you can make that happen, it can be amazingly valuable. So a couple of us managed to organize a return elective from the dental school in Rwanda for a student to come to Glasgow. So two groups of our students had been out to Rwanda. We thought, we've got to bring someone here, and we managed it. And it was fantastic because they heard from our public health people, the same guys who worked with Katie, about Child Smile, which is Scotland's model for prevention of dental decay in children, and it's been spectacularly successful. He went back to Rwanda, and then working with fellow students and one or two qualified dentists, they've established something called Bwiza Child Smile, which is a version of the Child Smile program that is applicable in Rwanda. So to me, that was a tremendous win from his visit here. So my view would be that in principle, as long as it's done on an equitable basis, it's absolutely fine. And that the students aren't doing treatments or procedures at the institution they're visiting where it's not appropriate unsupervised. But otherwise, I'm completely fine with it. But that's my view, and Andrew and others may have a slightly different view.
I agree entirely with your view, Jeremy.
Dr. Chunda, do you agree? Sorry, okay.
Ramus, I think Ivana was asking if you agreed.
Yes, I do. Sorry, there's some noise here. I've got some kids playing, so I couldn't hear properly.
Sorry.
Yeah, I do agree, yeah.
Okay, so thank you all, and I think that concludes the webinar, and thank you for all your questions, and thank you to all the panelists for the answers and the presentations today, and it was lovely meeting all of you, and it was very informative, and I'm delighted to have hosted this webinar, and have a very good night. You're free to leave.
Yeah.
Thank you so much.
Thank you so
Very
much.
much.
Thank you.
Thank you.
This was brilliant.
Bye.
Bye.
Thanks for having me.